Hi, I'm glad to be back. We wanted to talk a little bit about what are the measures that we're using to battle the coronavirus. You've heard the term social distancing. Let's say you're in a closed space, a bus or an airplane or a small room, and somebody has a common cold and they are sneezing and they are coughing and they are spewing their microscopic particles out into the air. Do you sometimes say to yourself, I wonder if I'm going to catch a cold? Well, guess what? You have a pretty good chance because you've been in close proximity with an infected individual who is disseminating the virus through their coughing and sneezing. So social distancing is acknowledging what we know about influenza virus, which is that the closer you are to an infected person, the more likely their air droplets will come into contact with your mucous membranes and infect you. So we're recommending everybody stay 6 to 10 feet away from everyone that they possibly can stay away from. I suspect that, a spouse, a child, you'll be closer. But if you can stay away from neighbors, don't greet them with the usual handshake, stay further away. That's what we mean by social distancing. If you are in tight quarters where in your apartment, we would like to decompress and have people able to live in such a way that they can be further away from each other. Another is simply hand hygiene. We know that hand washing really does work. It works to prevent transmission of viruses in hospital settings, in home settings, in schools, in daycare centers, and it is a very good strategy here. And if you just consciously wash your hands after every time you touch something or someone, surfaces can be cleaned. We know that stainless steel and plastic, the virus can live on the surface for 3 days, paper and cardboard for 1 day. So there's no harm in taking your mail, leaving it there for a day, and reading it the next day. You can clean doorknobs, you can clean bathroom fixtures, you can clean things so that after the use they've been cleaned. So the notion of cleaning before and after. So we're talking about hand washing, we're talking about cleaning of surfaces, and then what about touching your face and sneezing or coughing? The natural instinct is for someone to sneeze or cough by putting their dominant hand in front of their face. And that's not terrific because your dominant hand is what you're using for touching things. Your non-dominant hand is also something used for touching things, but you don't touch anything with your sleeve. So we like the idea of coughing into your elbow, so to speak, into your arm, into your sleeve. That is a number one preference. If you just can't manage that for one reason or another, your non-dominant hand, and then promptly hand wash. That's where sometimes the hand sanitizer is especially convenient, although usually soap and water is not very far away. So we also like people not to touch their face. Now I'm going to tell you I'm a face toucher. I've been a face toucher since I was a kid. I'm a face toucher now. And, I'm sitting here as dean of a school of public health and I'm touching my face all day long. I am not doing well with not touching my face. And I'm trying very consciously to do that less. But I do have some wipes nearby, and if I forget and I touch my face, I'm washing my hands. If I'm called into clinical service as wearing my physician hat, I will be shaving my beard. An N95 mask, these masks that do an especially good job filtering that we use when we're taking care of patients with respiratory viruses or respiratory bacteria like tuberculosis, they don't work well with people with beards. So I will shave my beard and then I will go into clinical service. Other strategies, of course, are to reduce your travel. Do you really want to be traveling in an environment like this when we have a growing pandemic in our own country? There ought to be an extremely compelling reason to travel. We would like you to stop traveling and try to what we sometimes call shelter in place. The notion of sheltering in place, which is what San Francisco's done, is to ask people not to leave their homes. Limit their leaving their homes to, say, twice a day for essential purposes. People have asked me, can I go for a run? And theoretically, you could go for a run. That is not considered to be a high-risk behavior, but you wouldn't go running in a group. And when you see people crossing you, you would give them wide berth. We don't want you to waste away at home, but exercise at home is wise. Exercise outside of the home in which you do not have contact with people, and going to the store in a decompressed fashion. When you have to go and purchase something, you might go when you know it won't be busy, and when you can perhaps do a large purchase all at once, and then you don't have to go for a few days afterwards. Do we want to support our local businesses? Do we want to prevent our restaurants from going broke? Yes, but there are ways of doing that. You can phone in an order or put it in online, and you can give your credit card information. You've ordered, you've paid, and all you have to do is take the bag from the owner. And so there are some common sense ways to minimize your time at the restaurant, your contact time. And to be honest, I'm trying to give a business to my local restaurants in that way because of an immense sympathy that I have with our friends and neighbors who are trying to keep their small businesses going. So these are a few thoughts about how we can help control the virus. And CNAs can be incredibly valuable on the educational side of this epidemic and providing adjunctive services for all the things that I've described, maybe even treatments in the near future. So thank you for your attention.